joining our high-level panel addressing non-communicable diseases during the COVID-19 pandemic, which has been organised by the Defeat-NCD Partnership at the United Nations Institute for Training and Research with the invaluable support of Boehringer Ingelheim. COVID-19 has killed almost 5 million people, while the number of confirmed cases in 221 countries and territories stands at above 242,190,723. Yes, the numbers are grim, but the data hides another less visible tragedy.
Research published in The Lancet in 2020 suggests that less than 10% of countries are on track to achieve SDG 3.4 based on trends in mortality between 2010 and 2016. Their analysis shows that low, middle, and high-income countries are all finding it challenging to meet their goal. So the question really is, why are so many countries not on target despite their significant efforts? There are no easy answers, and country-specific solutions, including fully costed national action plans, are needed. We must take forward important lessons from the pandemic and incorporate them into the way that we tackle NCDs. We need a collaborative approach involving close cooperation between public and private stakeholders. And finally, we need to take ownership of our own responsibilities and hold each other accountable. By doing this, we'll improve prevention, early detection and treatment, and hopefully achieve our goal of reducing mortality from NCDs.
Every 10% decline in the non-communicable mortality ratio, and this is preceding the current COVID case fatality rate, there is a 20% decline in COVID fatality rate. The World Economic Forum predicted or estimated that roughly $371 billion spent from now till 2030 would enable the world to achieve universal health access for all. In the last 1.5 years, the world has spent 4.5 times the total amount required for universal health access only on tackling COVID.
The risk of dying from a major NCD between the age of 30 and 70s continues to decline from 22% in 2000 to 17% in the year 2019. But the progress is highly uneven across countries. Only 35 countries has implemented 10 or more of the commitment made on the prevention of control of NCD and the United Nations General Assembly. Only 14, which is 1/4 countries, are on track to achieve the global SDG target 3.4 on NCD for the 2030. No countries are on the track to achieve all the 9 voluntary global targets for the 2025 set by the World Health Assembly in the year 2013.
Together with our partners, both local and globally, and taking the lead in that was the Defeat-NCD Partnership. Fortunately, this partnership continued during the pandemic. In fact, we actually got Defeat-NCD country coordinators sent to the Gambia to help us improve on the strategies, to look at the actual management of NCDs on the country, to develop a national multi-sectoral strategy and have a costed action plan for non-communicable diseases, because these are all important. Now, together with our partners and the Defeat-NCD Partnership, we are putting forward these strategies. Certainly, we need to be supported in capacity building to make sure that this bear fruits. We also need to make sure that we typically work together. For us to be able to defeat COVID-19, we certainly need to make sure that NCDs get the attention that they deserve. Thank you.
We strongly support the Defeat-NCD Partnership. We have just launched the initiative with our sister organization in the World Bank Group, which is called MIGA, to include more state-owned banks in our trade finance program. When these medical goods are procured or imported by the governments or the public sector, we hope to support the import financing needs through state-owned banks. This is the objective of this new partnership that we are launching at this moment. And we hope we will be able to expand our medical sector support through the Defeat-NCD Partnership. Thank you.
What we are seeing during the COVID-19 pandemic should not be a surprise. But we have known for a long time that NCDs make nations less resilient when outbreaks occur. it has never been more important to address NCDs on a global scale. Changing social, economic, climate, and structural factors mean that more people are moving to cities. And the spread of unhealthy lifestyles is fueling an NCD crisis. I look forward to working with you all as we partner to address this crisis.
So a deep dive into health system financing landscapes in low middle income countries is really better needed to understand how we can better finance health systems.
I mean, it's equity. Equity is the heart of whatever WHO do in all areas of health. So when COVID have laid bare the inequities and the huge underinvestment in NCD, I have hopes that actually the COVID and the Building Back Better is triggering transformable and sustainable changes, and that we have the possibility now to strengthen and build the partnerships that we have underway to be able to really focus on the 74% of the deaths that comes from NCD.
IDB fully aligns with the vision of Defeat-NCD Partnership that a public, private, and people involvement is much needed to achieve universal health coverage by 2030, and that the neediest and most vulnerable communities should be proactively supported and covered. Our joint work plan enhances national capacities and ensures that relevant institutes have essential structures and financing to tackle NCDs in our member countries. We also scale up community-led action to screen, detect, and improve care for NCDs patients in our member countries. IDB is also supporting the Defeat-NCD Partnership marketplace to enable quality and competitively priced medicines, medical diagnostics, and supplies to low-resource member states and low-income countries through provision of ordinary and concessional resources, and also also mobilizing additional resources from development partners for co-financing health sector operations. This includes trade financing support in support of NCD-related procurement. Gambia is an example of this support, where we will work with the government and Defeat-NCD Partnership to scale up cancer care. After successful implementation of joint plan, IDB will also be joining the governance mechanism of partnership to allow ISDB's experience to extend to all 90 plus low-resource countries.
That there can be no discussion about universal health coverage without having NCDs at the core of this discussion. There's no global response plan that will protect future generations from upcoming pandemics without strong, affordable, and resilient NCD prevention and care. We all know that there will be future pandemics, and unfortunately, people will die, but we still can take control and drastically reduce the impact and the suffering if we effectively address non-communicable diseases. The tools are there. The World Health Organization is playing a critical role in setting the standards and formulating guidance on the most effective and efficient ways to tackle non-communicable diseases. Private sector is investing more and more in research and development in support of low-resource countries and improving access to quality supplies and care. Resources do exist, as the Defeat-NCD Partnership and Economist Intelligence Unit research has clearly shown and so articulated earlier in Praveen's presentation today. And developing countries are taking the lead and setting example to the world with their commitment and advancement in tackling NCDs and an effective health systems-wide and multi-sectoral approach. The way forward is through strong partnerships. The way forward is to join our collective knowledge, skills, and resources to build healthy, productive, and resilient communities. Thank you very much.